In this video, we are going to talk about hepatitis B. 1/3 of the world's population have been infected and 600,000 die each year. Are you at risk? Hepatitis B is one of the most commonest diseases in the world, but many of you may not have even heard of it. The World Health Organization estimates that about 240 million people are still infected. So are you at risk? How is it passed on? And how can you protect yourself? First of all, what is hepatitis B? It's a virus that infects your liver and can cause long-term liver damage, leading to scarring of the liver known as cirrhosis and eventual liver failure. In some cases, it can also cause liver cancer. Where is hepatitis B most common? As you can imagine, it's found throughout the world, but it is particularly common in Southeast Asia, the Indian subcontinent, Middle and Far East, Southern Europe, and Africa. Even in Europe, it is thought that 13 million people are living with hepatitis B, about 1 in 50 people. Here in the UK, we estimate there are approximately 180,000 cases, many of whom are completely unaware that they have the infection. How is it passed on? The virus is a blood-borne virus, meaning that it can be passed on from blood transfusions or blood products. You can also get infected through sex, and a mother can pass the virus on to the baby during childbirth. If you inject street drugs, you are also particularly at risk. What are the symptoms? Symptoms are often mild, and you may not necessarily see a doctor. It can also be confused with flu. Some people lose their appetite, feel sick, or pass pale bowel motions and dark urine. The whites of the eyes and the skin may also turn yellow, commonly referred to as jaundice. So who is at risk? Anyone who might be exposed to blood or bodily secretions might get infected with hepatitis B. This includes healthcare workers such as doctors, nurses, dentists, dental assistants, laboratory workers, and other healthcare professionals. Other people at risk are barbers, acupuncturists, tattoo artists, sewage workers, and even the police. Do you participate in contact sports such as football and rugby? If so, then you may also become infected. Commercial sex workers and their clients, and people who inject drugs, are also vulnerable to the infection. So we now come to two important questions. Is hepatitis B curable? Sadly not. The infection is not usually curable, but it can be controlled with tablets. Okay, so can I at least prevent it? Yes, of course. It's entirely preventable with a safe, effective, and easily available vaccine. Travel Clinics is a trusted healthcare provider led by experts in the field of infectious diseases. If you belong to any of the risk categories mentioned and would like to find out more about how you can protect yourself from this devastating disease, give us a call on 024 7601 6519, or alternatively email us at info@travelclinics.com.